This is Martin Sweeney from Cytasan Healthcare, and welcome to this 10-minute presentation on Cytasan. Cytasan is the next generation first-line advanced wound care treatment. So why should we prioritise wound care management and patient outcomes? Well, first of all, straightforwardly, from a financial perspective, the wound care management costs somewhere between 4.5 and 5.1 billion per year. That's the third largest disease area that the NHS spends upon. There is a significant patient impact on mortality, but we'll come on and look at that in the next slide. And quite straightforwardly, there is a huge amount of time spent by clinicians in the management of wounds, and anything we can do to make that more efficient would be a significant value to the NHS. So what is the impact on patient mortality from chronic wounds? You can see in this study that there is a 66% increase in mortality when a patient is admitted to hospital with a pressure ulcer and a systemic infection. This is the second highest cause of mortality behind a pressure ulcer in combination with a metastatic solid tumour. So clearly infection that potentially leads to systemic infection is a significant risk factor. Therefore, we absolutely know that it's important not simply to treat the symptoms, the excess exudate in the wound, but that we also tackle the cause. What is driving that excess exudate? Now we know 90% of wounds with elevated protease will not heal. Therefore, what drives that elevation in protease? And we know that there are two principal factors. One is infection, the other one is inflammation. And part of that infection process is biofilm formation, and there is emerging evidence to say that this could be one of the principal causes of why a wound becomes and maintains itself in a chronic state. So we must be thinking about tackling infection, biofilm formation and inflammation in any treatment that we put forward for the patient. So when it comes to wound care management, what is our checklist and what does that contain? Well, on wound healing properties, well, we obviously want something that is antibacterial in action, particularly something that is effective against gram-positive, so bacteria such as MRSA, gram-negatives, bacteria such as E. coli, and fungal infections. We want to prevent the bacterial biofilm forming, so we want to have something that inhibits that process. We would like to have something that has an anti-inflammatory action to downgrade that persistent inflammation. We know that that's a strong contributory factor to the elevation in protease. And we do want to treat the symptoms, of course we do. So we want something that will absorb and lock away that excess exudate. What we don't want is a cytotoxic agent. Now, there is a lot of controversy around silver, and that is principally because silver will kill healthy cells as well as bacteria. So unfortunately, silver has no ability to differentiate between a healthy cell and a bacteria. That we want something that is active, not inert. So we want something that will protect the patient from bacterial invasion, and as we mentioned earlier, that biofilm formation. We want something that conforms to the wound. So any dressings, any absorbent materials that we use that don't conform to the wound wouldn't be a number one priority at this point. And then obviously we want to maintain patient comfort and not have products that are painful on their removal. So what is Cytasan? Well, Cytasan is a high molecular weight chitosan dressing that has a unique patented formula. But what does that actually mean in terms of patient? Well, what it gives the patient is a broad and strong antibacterial action. It is active against gram-positive, gram-negative and fungal infections. It uniquely inhibits biofilm formation, and it has a very innovative anti-inflammatory action where it interrupts the COX-2 inflammation cascade, all of which we'll review later in the presentation. Fundamentally, Cytasan gives you the power to heal. Let's firstly look at Cytasan's efficacy. So we can see clearly here that we've got an almost 66% reduction in wound size over a 4-week period, and that reduction is statistically significant. So what makes Cytasan's antibacterial action unique? Well, first of all, bacteria are negatively charged and Cytasan is positively charged. That enables Cytasan to bind to the bacteria cell wall, binding to the peptoglycans. And as you know, peptoglycans are unique to bacteria. And essentially, Cytasan punches a hole in the cell wall, enabling the electrolytes to leak from the cell, killing the bacteria. So how does this unique mode of action work? Well, when we look at MRSA, a gram-positive bacteria, that you can see that within a very short period of time, 2 hours, the bacteria have been eradicated. Against gram-negative bacteria like E. coli, which is a particular concern if a patient has a sacral pressure wound. E. coli is strongly present in human feces, that again within a 2-hour window we can see very clear eradication of the bacteria. And against Candida albicans, the very common fungal infection, we can see that this time within a 24-hour period we have eradication. We learned earlier that biofilm formation was developing as one of the principal risk factors in chronic wounds. And we can see in this study a comparison between control and a range of commonly used agents to inhibit biofilm formation. And we can see that Cytasan, in comparison to control, had an 84% statistically significant reduction in biofilm formation. And we can see that inhibition of the biofilm formation is active against a range and number of different bacteria, whether that's Staphylococcus aureus, Pseudomonas, or Candida albicans. There is a lot of controversy around the use of silver in wound care dressings, and that controversy really revolves around silver cytotoxicity. So in other words, silver kills both bacterium and healthy cells, and it has no ability to differentiate between the two of them. So unfortunately, in a wound that is attempting to heal, it will kill keratinocytes, fibroblasts, and other cytokines. Cytasan has a unique anti-inflammatory action. Cytasan interrupts the COX-2 inflammation cascade. COX-2 is the key enzyme responsible for the production of prostaglandin E2. And prostaglandin E2, we know, suppresses TNF and other wound healing cytokines. Now, by interrupting that cascade, we reduce and eliminate the production of prostaglandin E2, enabling TNF and other wound healing cytokines to grow and produce a wound healing effect. A key question is Cytasan as good as other leading brands in treating the symptoms of a chronic wound in the management of that excess exudate? And the answer to that is yes. As you can see in this straightforward comparison, Cytasan is as absorbent as Aquacel Extra, which is as absorbent as Durafiber. Cytasan offers not just its antibacterial action, its inhibition of biofilm formation, its unique anti-inflammatory action. It also offers a saving of between 4 and 72% against one of the leading brands in the United Kingdom, Aquacel. So in summary, Cytasan offers a unique antibacterial action. It inhibits biofilm formation. It has a unique anti-inflammatory action, and it is active in wound healing, unlike Durafiber or Aquacel Extra. However, it does treat the symptoms as well as Aquacel Extra and Durafiber. With regards to its gel forming, it absorbs the excess exudate, and that enables for pain-free removal at dressing change. Cytasan is the next generation wound care treatment. It has a unique antibacterial action that inhibits bioformation, that stops and interrupts the inflammation cascade, but absorbs excess exudate as well as any of the market leaders. You can find out more information at www.cytasan.com, or please contact me directly, martin.sweeney@ciadana.com. My phone numbers are on the screen, and thank you very much for listening today. I really appreciate it, and I look forward to seeing you in the future. Thank you.